I've heard you on some of your recent posts on social media, which, again, by the way, tons of great content there, is peptides. So
Hmm.
that is very new to me. That it's about as far as I know in depth, but other than watching some videos. But can you expound on peptides, the use of those, and
So peptides are a class of molecules that are going to fall within a certain number of amino acids. So an amino acid is the most basic building block of proteins. And so we start with a single amino acid, and then once you hit a few amino acids, you can then call it a peptide. And then, so a peptide will just kind of be a long string of amino acids. And then at some point, when that gets large enough and the peptides start to fold on themselves, then we get what's called a protein. And so a peptide is not necessarily new and unique in the healthcare space, and because we have peptides that float through us all the time. It's just in the last kind of 5 to 6 years, these peptides that are taken from our body can be really, really beneficial for healing, and they've kind of hit more mainstream. So all of the peptides that I use in clinical practice and that a lot of other doctors will use are actually all naturally occurring in our own body, which makes them really, really fascinating because they are not going to have some of the side effects that are commonly seen with pharmaceutical drugs, right? Because the way that pharmaceutical drugs are made is they're made to be very, very, very targeted at a specific thing that the researchers have determined to be, crucially important. So an example is cholesterol drugs like statins are going to specifically get at one enzyme, which is called HMG-CoA reductase, which is going to stop the production of cholesterol. So they've designed this molecule to interact with that one thing very, very specifically. But because of that, and it does it so strongly, there can sometimes be side effects that happen. Not always, and some drugs are worse than others, but that is unfortunately, it's a catch-22. It does a really great thing, but it might have some side effects. The peptides have a kind of more broader and more gentler action than our pharmaceuticals. And so, for example, if we're going to start somebody on a peptide like BPC-157, we may see improvements in their joint pain. It may just take 4 to 6 weeks for them to start to notice that, because it's a little bit slower acting, because it's not as direct and specific as something like ibuprofen, right? Everybody's got joint pain knows you take ibuprofen, usually within 20-30 minutes, you're feeling better, right? It doesn't last long term, but it has a very strong acute effect. These peptides, though, they take longer, but because of our body's great ability, we have these peptides already in us, so they obviously serve really important functions, is we can actually get full resolution of symptoms sometimes with these peptides. I've had many patients come to me who have had chronic joint pain, and we start them on peptides like BPC-157 or Thymosin Beta 4, and 3 months later, they're 90 to 100% pain-free. We stop the peptides and the pain doesn't return. And so we can actually get some true healing and regeneration with these peptides, which I think is absolutely, absolutely phenomenal.
yeah, yeah, especially like you were saying, it's naturally occurring in your body, so your body's not going to reject it per se, or some potential unintended consequence of some of the other medications like an ibuprofen.
Yeah. Yeah.
Over systemic use, could start wearing on other things like your kidneys and
In the liver, yeah. Yeah.
significant consumption, but nonetheless.
Yeah.